Let me talk very briefly next 10, 15 minutes, hopefully, so we can have some to take question. Emotional health. There are few things that have emotional, mental consequences in medicine, like weight-related problems. Right? Very few things have the toll on our emotions, how we feel, how we think about ourselves, like weight. The other one is our looks, right? Skin and all of that. But so something about weight and the emotions, and we all understand why, right? And this is the way I want you to think about it, since we are all on treatment. Now, I want you to think about it. I'll just talk very briefly the consequences of weight on our emotions, how we feel before we start treatment. Just weight alone. That's we have obesity, we have overweight, we are not on treatment. What are some of the consequences that you, of course, you already felt them? I'll talk about some of them now. The second part is now that you're on treatment, there are some emotional benefits you're getting, which I'll talk about. And then we'll talk about when you come off treatment, right? The weight is off, and how are you going to manage your emotions then? Really, really, really important. Again, weight loss is much more than the number on the scale. It has a lot to do with how you're feeling. And I know that. And you also know that's very important. Right? In fact, today we had somebody in the office. She is 136. She came to the office. I saw her. Okay, I asked my office staff, I said, why is she here? They said she wanted to lose weight. She had been on GLP-1 to some time before. So, of course, she came. She's worried because her usual weight is about 128, 130. She's had a kid, very, very particular about her eating. She's very thin. I mean, she's 136. But that for her, that is too much. She doesn't feel like herself. She's burdened. She's done everything possible, even taking medication from somewhere. That 6 pounds cannot just go away. You're going to say, if you look at it from a doctor's perspective, I'm a primary care doctor, right? Let's say she met me in the hospital setting. I'll say, why do you want to lose weight? You're fine. Just no, don't worry about it. But that is not going to fix that problem. If you tell her that as your primary doctor, let's imagine she meets me, she's going to go somewhere and look for a solution. The reason is there is an emotional attachment to that weight. If you don't fix her problem, she's going to find out somewhere. Of course, she went to some Dr. Christopher, so quite amazing. She went and got some, she's on 7.5 and doesn't feel a thing. And then she's asking me, okay, is this a real doctor? I went online, checked LinkedIn. I can't find the guy as a real doctor. Went to his website. He calls himself a doctor. Well, I've talked to you multiple times about this online things and all of that, right? So this is somebody who wants to lose just 6 pounds. Is on 7.5 milligrams. Is emotionally distraught. But you look at her, you think she's fine. But emotionally, something is going on. Those are the emotional consequences of weight. So it's not just a number. There's somebody who can have a lower number, but they look at themselves in the mirror, they are not happy. That is an important thing. That is why weight has a lot to do with the emotions. Now, very quickly, before you started treatment, obesity has emotional consequences. Weight gain has emotional consequences. I'll tell you out of experience, my wife almost got depressed. Many of you have seen her, right? You've seen her, how she used to be, she came to the US, she was like 150 something, 160. After her 3 kids, she went to 230. 230. In fact, the time I really pushed her to get this medication, I could see my wife changing, not happy, doesn't like, she loves taking pictures. Never, you'll not see her again. She used to like taking pictures, right? All the time. You don't see her. I could tell something was wrong emotionally. I had to really, really encourage her and hold her hand and drag her to take this medication. She's lost weight. She herself has come back. Weight has emotional consequences. So obesity in itself, depression, anxiety, shame is the one I see here a lot. Why does shame come in? Because This is the idea. I can't control my eating. I'm weak. I'm a failure. See how I look like. This is terrible. This is not me. I don't know what I've become in the US. Is this man or is it this man or is it this thing? Right? Shame and guilt and self condemnation and all of they are packed full. And most of the time, right, when I see patients, I could tell because I'm a wellness coach, they don't talk about it. But once you start asking them questions, they realize, oh, this is really what I was dealing with. Especially us Africans, we are not emotionally expressive like white people. We can cover depression and anxiety and shame really well. It's a tough skin. Black people, that's us, right? But it's not a good thing. It's not really a good thing. You can cover that like that, and it leads to things that we don't like. Right? So obesity has those emotional consequences. And let me tell you something that might help, even now that you're on treatment. Let me look for the best way to explain it. Let's say you were 150, you were 160 or 180. That was your normal weight. You remember I've explained this thing called memory. The brain has memory of your weight. It remembers your weight. Now, if you are 180, that's your normal. Your brain thinks that that's what is best for you. Now, you go to 190, your brain will say, like you can say, Josiane, something is not right here. What's happening? And then he waits and sees 1 month, 2 months, 3 months, 5 months, 1 year, you are like that. 2 years, you're like that. You say, okay, that's probably what she wants. And then your brain now remembers that as your normal weight. And then if something happens, it goes up again, it goes up again. The brain keeps remembering that as your normal weight. Now, this is what would happen. There is a point where once your weight crosses, I call it the obesity red line. You'll not see that anywhere. It's just my way of calling it. Once your weight crosses that red line, used to be normal and you cross that red line, your body stops functioning the way we usually function. Meaning that it's no longer about you trying to control your appetite. Once you cross that red line, your body says, okay, you have crossed the red line. What that means is your body takes over control of your appetite and your metabolism. If you try to lose weight, you discover that hunger feels like it will kill you. Have you seen you get up in the night, the first thing you think, even when you want to go use the restroom, the first thing you think is to go and get a small snack. Why am I always eating like this? You feel, and this is where the guilt and the shame come in. You feel like you don't have willpower. You feel like you're a failure. You don't control yourself. You're just eating and eating and eating and eating. The truth is, it is no longer just you. The body has everything it takes to make you eat like that. Once you have crossed that obesity red line and you even try to reduce, the body will not accept. It will increase your cravings. In other words, you yourself, you say, why am I always hungry? You don't want to be hungry, but you are telling yourself, why am I always hungry? That is called, is the best, let me look for a good word. It's normal body process, right? Normal body process. And that is where the shame and the guilt start coming in. And that's why the more we understand how weight functions, the more we can talk to you like this, that you know what? It's not as if we don't want to take responsibility. There's always that responsibility. But if you understand what is really going on beneath, the first thing that should happen is you should understand what is behind that strong cravings and hunger and all of that. I had a lady once who came to the office. By the time we started speaking, she was crying. Her wedding is coming. You know, you can look at her. She's really big. No kidding. Right? She's just, you can tell, emotionally overwhelmed, feeling guilt and shame. I told her the first thing she needs is not terzepatide. The first thing she needs is to take care of that guilt and shame first. All that guilt and shame that she has put on her head, right? And she looked at me as if I know her personal diary. Like her eyes open like that, and she just started crying because that's the burden, the emotional baggage she's been carrying for so long. right? She looks at herself, can't go out, shame, guilt. You know how people look at you when, you're morbidly obese. Of course, right? There is a lot that goes with that. And then the feeling is, look at this one, you keep eating and eating and eating and eating and eating. So that is obesity, its effect on our emotions. Right.
Howdy, how are you?
Okay. Yeah, Edith, please take care of that. So that is really, really important. And for some of you, it might not be surprising to me. You might be still dealing with something like that. Right? And if you're still dealing with it, this today, you might just come to the realization, oh, okay. Not that it's going to stop, but for you to understand where it's coming from, you are better prepared to handle it. Right? Now, so that is obesity before medication. Now you're on weight loss medication, right? What are some of the benefits you get? This is a good thing. Tirzepatide has no negative effect on our emotions. It doesn't cause anxiety, it doesn't cause depression, doesn't cause shame, and all of those things. They have studied it. So we're very good on that. Does it directly improve your emotions? Is it an emotional medication? No, it doesn't. But it has indirect effects. The first is what many of you have experienced. Cravings usually drop. Once cravings drop, you start feeling better. It's as if a burden has been lifted from you, right? A burden has been lifted from you. Cravings start dropping. In other words, it's telling you those cravings were due to your body just overreacting. If medication can fix it, it means it's not necessarily just you. It's a biological thing that was pushing you to have those cravings. So, one of the fastest benefits, emotional benefits. And how does that help you emotionally? You feel better. Many of you have told me, right? After that first month, second month, oh, it's like finally, we call it food noise. No, it's like always there's noise in you. You're sleeping, you're dreaming only about okra soup that you're going to eat, or that chicken stew, or goat meat. You're like, finally, I can take a break. I can go to sleep and not think about the soya that I was going to eat. Food noise has come down. That's a huge emotional benefit. The second one that we see often, I really want to stop at 20, so 3, 5 minutes. Second one that we see often is the compliments. Oh, those compliments. Some of you, I've seen your pictures. I could not even believe it myself, right? That is fantastic. You go out, the society is just tailored that way. You can't stop it, right? People notice weight changes so fast. They're like, oh my God, what happened to you? You are looking fantastic. Those compliments, they are a huge boost emotionally. They can have a little negative effect sometimes, but overall, they are very positive. They are encouraging. They make you feel better. So once you get on medication, those compliments start coming from family. I don't know. I had a meeting, follow up with somebody this week, and told me, Dr. Oben, I've lost too much weight. My husband is now asking me, why are you getting too thin? Told him I'm going to charge him double. He now has a model in his house. I don't know, maybe I can't remember. Of course, I can't say the name, but you might be on the call. But that was really, really nice. Your husband looks at you and say, "Oh, my wife. Okay, this my wife is back." Or your friends like, "Oh, girl, what is happening to you?" Some of you have referred us clients because somebody saw you and said, "Oh, what on earth is happening to you? I want what you want." Now, the emotional benefits of those compliments are huge. Now, these are the negative aspects. Number one, once those compliments will not always be there. People notice it the first few months you've lost weight, right? Once you've lost weight, you are the normal weight. After 6 months, 1 year, of course, people will not still be telling you, "Oh, girl, you look wonderful." When those compliments drop, don't feel like something is wrong with you again. Right? That's a potential negative aspect. The second one is some people think, okay, So now I look better. When I used to have that weight on, what was the problem? Right? In other words, the compliment is like making them rather feel bad. But whatever, take it as a positive boost, right? If you're losing weight, that is good. Take it as a positive boost. Right. Now, the anxiety, depression, and some of the things that usually come with weight, as weight comes off, those things start coming down equally. So those are the benefits you can get, right, from GLP-1. Now, after GLP-1 weight loss, after you've reached your goal, you've been on maintenance dose, you're off the medication and all of that, right? There is something that comes on, is the fear of regaining weight. That is a mental health problem, which that's why you're here. Right? We educate you, we prepare you. Like many of you realize we want you to succeed. We just want you to stay here. I'm a doctor's office. I'm not Amazon. Right? I'm not a drugstore. You just go online and know. I'm a doctor's office. Meaning your health is our primary concern. We want you to succeed. So when that stage comes by, you start getting afraid. We prepare you to succeed. Succeed. Now, not 100% of you are going to respond in the classic way. We taper you down and we take you off. You look all wonderful. Your bodies are very different. We're going to work with you. But that fear of weight regain, rather than being afraid, just know the options. Know the options. Know that, of course, once you stop the medication, there might be a 1 or 2 pound weight gain initially. Those first few months are usually tight, right? You prepare your mind, you know what to expect, you have proper guidance. When it happens like this, what should I do? What should I do? That's why we are here. There should be no fear of weight regain. When that fear starts coming back, you're getting into an emotional roller coaster again. Right? So fear of weight regain is a big one after you've lost weight, meaning that we should prepare you and you should be prepared. Right? You're losing the weight. We've told you about the 3 phases. We do everything possible to make sure that weight doesn't come back. Lifestyle intervention is a big one. Don't change yourself. Don't start eating salad and just something that you cannot enjoy for long term. You're going to be yourself, but a healthy version of you that can sustain that weight. We talk about lifestyle, we talk about eating patterns, we talk about activity patterns, right? That will help us as much, right, when we go up. So that's already really beyond my time. I know we might have some questions here. Let me pause here